Well, as the vaccine rollout continues, Mercy Health St. Mary's is putting extra focus on those in underserved communities.
Several health leaders hosted a virtual press conference today, stressing patience as they work quickly as they can to get vaccines administered.
Vaccinating our patients in the community will take time.
About 2 months after Pfizer and Moderna's COVID vaccines were approved for emergency use, Mercy Health's chief medical officer, Dr. Matt Biersack, says supply is still an issue.
There is a significant demand for vaccine. Unfortunately, at this time, demand really outstrips supply.
Dr. Andrew Jameson, the medical director of infection prevention, says they've administered 97% of their supply allocated by the federal government.
So far, to date, we have received in hand 22,640 Pfizer vaccines. So that is what we have actually received, and we are starting to distribute. Of those received, we've given out 21,960 of those. Basically, whatever vaccine comes in goes into arms that week.
As we move through these vaccine phases, Dr. Jameson says last-minute scheduling for high-risk populations has been difficult, so they're pivoting.
For our Clinica patients, which is in the 503 zip code and serves a significant Latinx community, we're going to be embedding a vaccinator in that clinic to try to meet people when they show up for appointments. As they see their doctor, as they get to a situation in an environment they trust, they can then schedule an appointment for a vaccine, and it may be actually at that time.
It's just one way. Dr. Karen Kennedy, the regional medical director for Mercy Health Physician Partners, says they've been working to target underserved communities, especially when it comes to education and vaccine reluctance.
It's not always just about the amount of information out there. It's about who is telling these populations the information and whether or not these populations trust it.
Mercy Health hoping most people choose to get vaccinated when their time comes, offering plenty of access from large clinics like the one at DeVos Place to right in their doctor's office.
We want to offer lots of different opportunities so that folks can really feel comfortable with not only the vaccine itself, but the site of care and administration of it.
And Mercy Health says that they've also gotten 1,500 doses of the Moderna vaccine, but they haven't actually administered those doses yet. They say those will be used at smaller clinics down the road, since those vaccines have a longer shelf life and they don't require those same extremely cold temperatures that the Pfizer vaccine does.